Welcome, everyone. We are just getting situated and letting everyone into the Zoom room. We have over 100 participants in today's conversation, so we're going to get everyone in before we get started. So hang tight for just a moment, and we will start today's presentation in just a moment.
Here. Oh no, it's
again. Welcome, everyone. We are going to get started in just a moment. We're letting everyone get connected to the Zoom room before we start today's conversation. All right. We are going to kick off today's conversation. We have most people in the room already, and so good time to start. So welcome, everyone. My name is Jennifer Thompson, and I am the Executive Director of NASW New Jersey. And I'm really excited to join today's conversation and the important content that's going to be provided. A few housekeeping rules before we jump into the dialogue today. We have people watching on Facebook, so welcome everyone. If you do have any questions, we invite you to write them in the chat box on Facebook. We have a team monitoring that and we'll be able to ask those questions live. For those of you who are in the Zoom room and participating today, we are going to allow for Q&A throughout today's presentation, so you can shoot them in the chat box if you'd like, or write them directly to me. Look for Jennifer Thompson and you can privately chat them to me and I'll be happy to ask them. We have a couple of our team members on also helping with today's conversation. We have Jeff Feldman and Helen French, so if you have any questions, you're welcome to ask them as well. Today's presentation will be recorded, so you can share with friends and colleagues and will be available on the NASW-NJ website after the broadcast today. Just as a friendly reminder, we did all sign a code of conduct for today's conversation. We encourage dialogue and chatting that's relevant to the conversation being had. And we ask that you all keep it professional as we know you well. And we do ask that you don't share personal contact information in the chat box. We do reserve that space for dialogue about today's conversation and question asking. So with that in mind, we're going to jump into today's conversation. Now, it is no secret that New Jersey maintains a broken and inhumane youth system or youth justice system. And we lock up Black children at almost 18 times the rate as white children, even though they commit most offenses at similar rates. This is the highest disparity rate in the entire nation. Today, we are joined by Ashanti Jones, who is a social worker, MSW, and manager of community engagement at the New Jersey Institute for Social Justice for this community conversation. And she will be discussing their recently released Toolkit, Investing in Youth, Not Incarceration, a toolkit for creating community-led approach to youth mental health. The toolkit is released in partnership with Salvation and Social Justice, and she's going to be providing more information to us today about this toolkit and the work that they do. So welcome, Ashanti. Thank you so much for joining us today for this important conversation and sharing with us what we need to know to be better advocates.
Thank you, Jennifer, for that warm welcome, and thank you, NASW New Jersey, for allowing me this opportunity and this space to connect with you all regarding the great work that the New Jersey for Social Justice is doing in the youth justice space. A little background for those of you who do not know what the Institute does. We are a legal advocacy organization that focuses on basically bringing equity throughout the systems that unfortunately disproportionately impact people of color in New Jersey. We work across 3 pillars primarily, and that is economic justice, where we focus on housing equity, closing the racial wealth gap, undoing redlining, those types of things, and also reparations. We also work across democracy and justice, where we want to restore the right to vote to all citizens in New Jersey, because no one should be disenfranchised from the democratic process. And we also work across criminal justice, which we'll be talking about today, where our major focus is closing youth prisons and investing in a community-based continuum of care. A lot of our work focusing on the youth justice work and closing youth prisons started in 2017. And that was the launch of our 150 Years is Enough campaign. So for those of you who do not know, I mean, at this time, it might be more like 154 years since New Jersey has been investing in an antiquated, broken system of youth incarceration. 154 years ago, what's now known as JMSF, was a prominent Black academy where young scholars would go to, be educated. And unfortunately, after school desegregation, they weren't able to garner enough white enrollees to be considered desegregated. And so the school was subsequently closed down and then turned in that same year into a prison. It has been operating as such for 154 years. And so the purpose of the campaign was to say, okay, 150 years is enough, okay? We've invested so much time and so much money into this broken system, and that's not really doing anything because recidivism rates, aren't going anywhere. We're not addressing youth behavior. We're not getting to the root cause of why young people are being incarcerated in the first place. And so when we have a cost, I mean, at the time of the campaign, the cost was around $285,000 per young person. Last year, that cost was about $300,000 per young person. And now in 2021, New Jersey is now investing $445,000 to incarcerate a single young person in New Jersey annually. And the reason why that's so problematic is because there's so few young people incarcerated right now. I think our youth incarceration system, due to advocacy, especially during the pandemic to get young people released, we have around 80 young people who are still incarcerated. And when you have 80 young people who are incarcerated and you're spending almost $500,000 to incarcerate them, that's problematic just because that gives us about $6 million that's in the juvenile justice budget that can be used for community-based continuum of care. And I see a question here that said, is that under 18 or including young adults? That's including young adults. So sometimes young people might be incarcerated at 17, but their sentence may be 4 years, and so they'll get out in their early 20s. But we consider youth to be anyone from, I think in New Jersey right now, it's like 13 years old to 26 are considered young people, and that's youth incarceration because that's usually where young people are coming out of prison and reintegrating once they've finished their sentence. So we are, spending almost $500,000 in this system that doesn't work because, within 3 years, around 70% of those young people are, going back into the youth justice system. There aren't any community-based supports that really support re-entry for young people. And we already know there's such stigma around being incarcerated in the first place that there aren't a lot of community systems that really support young people reintegrating successfully, and that's in the education space, the career space, and the public service space. So our goal was to say, okay, we're spending this money, and we have so many other alternatives. And so what we did, and a part of my role at the Institute, is to understand how the problem is experienced by people in the community. And so we went into the impacted communities. We took a look at where young people are coming from. That are being incarcerated. And we saw that they mostly were coming from 6 cities in New Jersey. And that was Trenton, Camden, Atlantic City, Newark, Patterson. I'm not sure if I said Camden already, but Jersey City. So we took those 6 cities and we kind of explored with community members, faith leaders, impacted people themselves, and tried to understand, how can we stop this, right? How can we stop young people from going into youth prisons? And so a bunch of things came out of that, right? These people who are stakeholders, their parents, teachers are saying, maybe if we had this in our community or had that in our community, we can probably, put a stop to young people going into the youth incarceration system. and understanding the racial dynamic. Around 96% of our youth justice system are Black kids, right? And unfortunately, what that means is that the whole system of like mass incarceration and racialized incarceration is most detrimental in New Jersey. We have the highest disparity rate in our adult prisons as well as our youth prisons. And so in order to stop those things, we have to understand exactly where we're failing as a community and how we can together build systems that would support young people staying in their communities. And so one of the biggest things that came out of that was restorative justice. There are plenty of restorative justice programs. We even had one in New Jersey that was proposed by one of our restorative justice in education and in schools. And it's more of a mediation style thing that really kind of puts a damper on the school to prison pipeline, right? We don't want youth behavior conflict to result in suspensions or expulsions, because we know that also disproportionately impacts students of color. And also just leads to that and perpetuates that school to prison pipeline. And so what we did was kind of took that framework, but then looked around the country. We consulted with California, with Baltimore, with Chicago, who've been running really impactful restorative justice programs in the community for about like 7+ years. And so when we were able to see their results, we consulted with them, we trained with them, and we co-wrote our restorative justice toolkit. And I'll just share my screen here so that you guys can get a sense of like what that restorative justice toolkit looks like. And so it's a community-led approach, because everything that came out of our visioning sessions with community members who were impacted by this issue was turned into this toolkit. And so we really ran down what restorative justice is. And restorative justice is really centered on resolving conflict and harm. It's about restoring the relationship, right? We understand that communities that are more close-knit, that understand each other, that feel responsible for each other, are more likely to do right by each other, right? And so the restorative justice space, we're really focused on those conflicts, those community conflicts. Maybe there's a young person who's been shoplifting from a local store, or they're just community conflicts, student to student, community member to community member, or even law enforcement to community. When we have those types of conflicts in the community, restorative justice really focuses on centering everyone's feelings. So not only the feelings of the victim, but the feelings of the person who committed that offense, right? And so we bring them together in a restorative circle, a peace circle, and community conferencing, where both parties have support persons there, and it's ran by a trained facilitator, where we'll talk through exactly what happened, the perspective of the person who was harmed and the perspective of the person who did the harm. What we're hoping happens in this space is that the person who committed the harm understands the impact of their actions. They may have stolen what they thought was $1 worth of something from the bodega, but unfortunately for that family who owns that bodega, that dollar is taking away from their livelihood. And so to understand the impact of your actions to the community systems around you is really important, and is a crucial part of the restorative justice practice. We also talk about transformative justice practices, where we want to transform systems. So not only transforming people to people, but transforming system to system. So how do we interact with our schools? How do we interact with our police? And so our restorative justice model really centers on looping in everyone. So in those circles, not only is it the people who were harmed and the people who committed the harm and their support persons, but we also want to loop in personnel, maybe the arresting officer or the school resource officer, or the public defender or the attorney, whoever is looped into here, so they can understand the community a bit better. So we're hoping that our public safety model, when they're looped into this restorative justice practice, will hopefully understand a bit more about how we should be interacting with young people who are more likely than not to have behavioral issues that result in criminality. And so we provided in this toolkit, how do we do everything? How do we create a community restorative justice hub, right? How do we form a community accountability council? We also provided a grant proposal, sample letters to get support for community conferencing volunteers, to get the to get law enforcement involved in this proposal. We did, sample budgets, and we also gave people a very clear outcomes and impact part where we can understand and know whether or not our restorative justice hubs are working in the way that we intended them to be. And so, not to spend too much time on restorative justice, but I wanted to give you that framework to understand where we went with mental health services. And so part of what restorative justice does is not only serves as a buffer for young people not having to enter the criminal justice system at all, but it also serves as a space for people who are re-entering. So when we're talking about young people going into youth justice system and coming out, and there's no kind of support or guidance to what comes next for me, right? How do I successfully reintegrate? Where are the resources that I need? What exactly do I need to do to kind of mitigate whatever issues kind of brought me to the space in the first place? And so the Restorative Justice Hub operates in that same way. Not only serves as a resource center or a space for community conferencing and to resolve conflict, but also as a place for comprehensive reentry services. And so mental health. And now we move into our next toolkit, which is our phase 3 of this project, which focuses on mental health and how imperative and important it is to talk about mental health when we're talking about young people who are being incarcerated. And the reason why we decided to talk about mental health is because we saw that not only nationally, but New Jersey is very on par with the national number. 70% of young people who enter into the criminal justice system have a pre-existing mental health issue. And when you say that, it's like, okay, so these kids are walking around and they have mental health issues that are untreated or maybe, even undiagnosed or diagnosed or undertreated. And then they end up in this criminal justice system that not only exacerbates their mental health issues, but also throws them back out into the street once they're done with their sentence without any additional resources. So even if they're getting any sort of, despite the quality, right, any sort of mental health services while they're incarcerated, once they're out and back into society, they're kind of like left on their own. And we really just didn't want that. And we're seeing such a large amount of young people having mental health issues. We thought, okay, so if our goal is to try to get young people to not be incarcerated in the first place, then we have to have preventative mental health services. And it's not that mental health services are not available. I mean, I'm on this call with a bunch of social workers. So mental health resources are definitely available. It's about accessibility, right? It's also about stigma. It's also about rewriting what mental health looks like and what it means for someone, right? In Black and Brown communities, we saw that a lot of the stigma around mental health came from 2 places. One, we don't speak about mental health, right? We don't normalize it. We automatically think mental health means crazy, right? And no one wants to think my kid is crazy. The second thing is that the providers are not always coming from a culturally competent place, and parents and young people are unfortunately don't want to pursue services from people who don't look like them or do not have kind of the frame of reference in the community that they come from. And so when we talk to people from various communities, we went into 11 areas this time to talk to people because we went to the impacted communities, but we also talked to their suburban counterparts to get a sense if there was a difference in how people were experiencing, to see if there was a difference with how people were experiencing accessibility, mental health, and also the barriers to mental health. And so when we talked to 115 people across this state, what we came up with is that there are some themes, right? There's definitely a lack of access. Families were given appointment times that were months away from the time help is sought. Mental health, like phone services, were really reserved for people who had insurance, if you needed telehealth services, or crisis. So I have to be in crisis, a threat to myself or to others in order to get services. And this is just the perception of community members. And when you may be noticing something's wrong with your child, but it's not necessarily a crisis situation, you don't really know where to turn. All I know is a suicide hotline and my child is not experiencing suicidality, it's kind of I don't know where to turn here. And so we also realized that mental health services are sometimes a little bit far removed from the core placed in the city where people need them. And so sometimes transportation can be a barrier. So that's, an infrastructure issue and maybe a financial issue as well. We also realize that there's just a lack of accountability on the part of mental health professionals as well as community members, right? So mental health is one of those things that you don't really publicize. You don't really go to the community meetings, you don't go to the fairs to table and talk about mental health services all the time. It's something kind of like, if you need me, you'll find me. And we realize that that can't be the case, because if you want to normalize mental health, you have to normalize mental health in those spaces that are considered normal, right? So mental health providers and services should be at the parent-teacher conferences, right? They should be tabling at the community events, at the back-to-school fairs. And so that's just not something that we were seeing. We also noticed that there was just something about mental health care not being taken as seriously as physical health care. We just don't normalize that as well as we should. We also realize that, well, the whole bread and butter of this whole thing is that we have an over-reliance on the justice system. We consider behavior problematic, and especially when it comes from Black and brown kids, that's just the truth of the matter, right? When behavior issues are met with, police officers, in schools rather than social workers, who are responding to behavior issues, we not only reinforce cultural trauma, but we also make very, very damning unspoken associations between mental health and criminality, right? We cannot make people feel that me having a mental health episode or needing mental health is a crime or is bad. And when you have those very young minds in schools, especially when mental health is, parents especially understand that a lot of our mental health services are in schools. They, oh, my kid's talking to a social worker. In school, they're fine, right? But what happens over the summer? I feel like there's a summer slide with academics, but there's also a summer slide with any kind of mental health or social work interventions that you're doing as well. So if a kid is getting, those 9 months of like really strong mental health services, but we're not talking about, we're not doing anything like with an NST team or, looping in parents all the way and showing parents how do we, continue this work, over the course of the summer, or you just don't have parents who are active enough, we're going to experience a lot of backsliding with that as well. Also, there's a lot of stigma, lack of mental health information. We also realize that a lot of people just loop mental health provider and just think that they're all the same. And us as mental health professionals know that, a psychologist is different from a psychiatrist, a social worker, master's and doctor's level therapist, all of these things are different, right? And so a parent might think in a school, my kid's talking to a social worker, but that kid might need a little bit more, but they don't really know the difference. And they're not able to see the type of care that that kid needs. And so just kind of normalizing that. So in our toolkit, we definitely put some key concepts and definitions for mental health for community members. And we also talked about what the community-based continuum of care can look like. How do we catch young people before their mental health issues exacerbate into a place where they may need incarceration? And so what we decided to do was add mental health services to the Restorative Justice Hub. So the Restorative Justice Hub actually was a toolkit, but it actually got turned into legislation that was actually recently signed by Governor Murphy. So it's now law. That's an $8.4 million investment, which is about 20% of the budget for mental health, for juvenile justice in New Jersey right now. $8.4 million is going to fund a 2-year pilot in Newark, Patterson, Camden, and Trenton, the 4 areas where the most young people are coming from and being incarcerated. And they'll get these restorative justice hub services, right? And so our next step is saying, okay, so if we're talking preventative now, we can add mental health services to the restorative justice hub. And so this toolkit focuses on community cafes, which is really a national model, right? Where we bring together mental health professionals and parents, community members, anyone who might be interested, maybe even impacted people, to come together and normalize mental health conversations, right? We want to talk about the questions that people have. And when mental health providers come, you don't have to wait for people to come to you. People will actually kind of know and say, okay, well, I didn't know that was here, right? My kid can really use that. Or like, oh, there's play therapy in my town. I didn't know that, and my kid can probably use that. So what we'll be able to do here is strengthen relationships between mental health providers and community members. We'll also be able to discuss mental health concepts and concerns, really share stories, swap resources, and develop campaigns that can create space for us to develop solutions to this outreach problem that we seem to have in Black and brown communities. And so we're hoping that community cafes can be ran similar to community conferencing, where we have this safe space circle, where people don't have to feel ashamed to ask certain questions or say, where do I go for this and where do I go for that? It is not, not providing mental health care, but just providing resources and information. We also gave people a how-to on how to do that. Community accountability councils will have parent and community liaisons that will kind of map out in communities where the mental health services are, how do people get in contact with them, if there's any like travel, if there's travel stipends, anything that people can do, if they offer telephone services for people who can't make it, they'll be able to provide a comprehensive list of culturally competent social workers and organizations and mental health professionals that we can keep at the hub, that we can, anyone who comes in with those types of diagnoses or needs that type of help can access. And I guess the biggest part of our, toolkit is this mental telehealth line. And so we spoke a little bit before about the existing telehealth lines being reserved for people who already have insurance and can kind of access that through the insurance app, or for people who are in crisis and may need more immediate help. And so our telehealth lines are going to be volunteer-based. And so our community accountability councils will be liaisoning with mental health professionals and organizations. We'll kind of be getting people to volunteer to staff these lines, right? Where people can get help when they need it, rather than having to wait that long appointment time that sometimes happens when people are trying to reach services. And sometimes will be volunteer staffed, and we kind of gave everyone a how-to, right? And so also we will be making sure that the training that's involved in the mental telehealth line is culturally competent, based in critical race theory, understanding cultural trauma, and really tuned into the actual situations and the adverse childhood experiences that are very prevalent in the area that they'll be serving. So very extensive, very focused, like laser focused training for people. And it also gives, a lot of telehealth lines don't give people an opportunity to follow up in person if they'd like. And because our mental health telehealth, they can be anonymous. If a person chooses to identify themselves and make an appointment for the Restorative Justice Hub to come in to talk, they have the option to do that. So they don't have to wait that, they don't have to wait that appointment time, but they can actually come into the Restorative Justice Hub to get connected. So at least if they, even if they have to wait a little while to get like formal, individual services, they're still able to come and participate in this very safe, conducive space that will not lead them to be incarcerated, hopefully. And so our toolkit kind of gives us the how-to, the nitty-gritty on what do we do first, right? So it's like literally a list of like things you have to do and the subsets to get this line staffed and funded. It even gives an evaluation, grant samples, budgets, everything that you need to get started. And so we even include a sample letter to invite a provider to participate in the mental telehealth line. So like people who are interested in starting one can literally take this letter, send it out. We provided some indicators of success as well and some additional resources. And so this toolkit is my baby. So I'd really love for you guys to take a look at it and ask mental health professionals, see how you can not only take the concepts in here and kind of integrate them into your work with families, or even something that you want to do on a community service level. But overall, our goal here at the Institute is to close youth prisons. But in order to do that and make a case, we have to create robust systems in the community that can support the young people who are coming out. We don't want to say, let's release all young people and they see you later, right? And hope it all works out for you. We don't want to give our state a reason to continue this antiquated, broken, very harmful system. Right now, we're working on a cost of incarceration report where I've personally interviewed people who were impacted by incarceration, who had mental health issues and unfortunately have been completely broken down by that system. And it's unfortunate. We don't want the stewards of our future, literally, who represent, who New Jersey is and what we are, to be impacted by such a harmful system. We want to continue to create and advocate for these systems that will not only establish front-end mental health services, but also reduce our reliance on punitive measures. And so, something else that I forgot to say, but it's also critically important, is that the reason why community-based services are so important and why outreach is so important on behalf of the mental health providers is because we had young people who were coming on our visioning sessions and saying that the only reason why they pursued higher education was to continue to receive mental health services. People should not be going into debt to receive mental health services. That, and I've heard it way too many times for this to be, and I never considered that's the reason why people are like saying, I'm going to go to college, right? Like I think I'm just going to go and try to get a degree because I have no idea where in my community I can find services, or I can't afford the services that are in my community. I don't have insurance, so how can I get, like, my mental health is that important to me. And so I had never considered that to be a reality, but it is. And so, like, that's my call to you all as professionals, to understand that our young people need us. And in order for us to be the best providers that we can be, is to just make sure that we are where they can find us. And so, the toolkits are here. I'll definitely paste the link, if it hasn't been already, to the mental health toolkit, so that you all can see it and kind of do what you will. And I'll also post my email address. So if you need any help or any guidance or want to understand any of the concepts that are listed in the mental health toolkit, we'd be able to definitely help.
Thanks. That's a lot. There's a lot to unpack here, right?
I'm talking fast because there's so much, but I'm definitely open to answering some questions at this point.
We actually have one that has come in from Facebook. So I'd love to just dive into a couple of them, and then I have a whole list of my own. But before I turn to my questions, also, if you have a question and you're here in the Zoom room, if you'd like to raise your virtual emoji hand, we will bring you on live to ask your question if you'd like, or you can drop them in the chat box as well. One that did come in from Facebook, though, regarding some of the stats we talked about in the initial part of the conversation today. So New Jersey has great mental health system of care for youth, one of the best in the country, they say. Yet the disparity regarding incarcerating Black youth versus white youth is so significant, even though the rate of offense is similar. What's the disconnect? Any thoughts on, why that is? I think you touched on it, briefly in the toolkits, but any other thoughts on why that might be the case?
Yeah, I mean, well, in just regards to the children's system of care, like, yeah, it is really great. And it is I do agree, it's one of the best in the country. However, it's still incredibly exclusive. And so we have to realize about, like, what young people are able to access those services. And then you also have to realize the kind of harm that kind of comes with being involved with the children's system of care, right? So some parents don't want to be system involved or have to be considered system involved for the young people to get services. And so the ability for certain youth to access, those services. The second thing is that we just have to realize that the entire crux of social justice is racial justice, right? We have to understand that New Jersey was the slave state of the North, right? We have such a harmful history that has not been rectified. We have not even addressed it, right? We even had we had a Juneteenth rally about, say the word, right? Reparations, right? And the governor established a wealth disparity task force, but he didn't call it reparations. And he's not talking about the racial wealth gap, just wealth disparity, right? And so we're still having a hard time in 2021 understanding historically how we have disenfranchised certain members of our communities. And until we as a state kind of say, okay, our ancestors really messed this up for us, right? And our state, the people are still feeling the residual impacts. We're still, the North riots happened in the 60s. We're still feeling the residual impacts of that, right? The communities are still recovering from that. And so you can only imagine hundreds of years of oppression and political oppression, right? That has happened. And so when you think about policies and how they just kind of present themselves differently in different communities, Black and brown people are unfortunately going to always bear the brunt of that until we rectify those systems. So that's why we see those huge disparity rates. And we're talking about young people who are being incarcerated for the same crimes, right? Young white kids and Black kids, they commit crimes at similar rates. However, a white child is more likely to be diverted. And that might have something to do with the advocates in their corner. It might have something to do with the school systems and, how they, interact and intercede on their behalf. the Black communities just don't have that. And there's just so much, there's so much, so much that goes into that, right? The resources in different communities are so disparate that we unfortunately will see these disparities in everything. And unfortunately, New Jersey leads in the worst ways in these ways. I mean, at the beginning of the pandemic, we had the #1 rate of people dying in jails and prisons from COVID-19, right? And unfortunately, that's because most of them are Black. And unfortunately, Black people have pre-existing conditions at higher rates than white people. And a lot of that, like, we just have to realize that all of this kind of feeds into each other. And until we as a state understands and rectifies those issues, not only just, just say it, like we messed up and we have to politically make the correct choices. And so that's the reason why we're doing these toolkits. That's the reason why we're doing the work that we're doing, to kind of help undo that harm and that trauma.
It is so interconnected, right? And
Yeah.
it is so interconnected. And it's interesting that I think perhaps in 5 years ago, when there wasn't, Instagram and live videos and streaming and TikTok, you wouldn't see it so much in your face. But even today, you can see, people being pulled over by the police officers in our community, right? And there'll be, white individuals making TikToks about like racing police officers and to get out of tickets and like funny jokes and things of that nature. But the seriousness of that is that if it were a Black and brown person, they would have a totally different experience. You're definitely not making a TikTok with the officer about getting out of that ticket. Mm-hmm. And that trickles down to the children in our community, right? They're experienced the same thing, and absolutely unconscionable. One of the things that I thought you brought up that was really interesting is that our elected officials, our governor even, can't say the word reparations. And if you can't say that and call it what it is and engage in a conversation about that, how can you even begin to acknowledge the disparity in youth incarceration? Because to me, and I think probably all of the people on the call here today, were thinking, wow, all you have to do is see that stat and know we have to act. But we can't say the word reparations. So that's where we're at. We're still not in a place that we can address these things.
Exactly. We're not there yet. And I mean, that's the fight, right? To continue to press our officials. And we have to say, okay, at one point in history, this was the law of the land, right? And it had a disproportionate impact on us. We have to, we have to say the word. We have to literally say, listen, we messed up. We have to do better. And it's going to take political action to do that, because a lot of the policies, they just impact communities differently. And so that's why it's imperative that we have things like the Restorative Justice program, pilot program, that will help, kind of divert young people, that'll serve as that diversion program, but also as that reentry program too. So we have both sides of that coin there.
I'm curious to know, like in the research that you did in your community listening sessions and all of that great work, and so phenomenal to have a social worker leading this charge and writing these toolkits, because you can absolutely see the underpinnings of our profession reflected in how they've been developed. Were there conversations from the community about social workers in police and police departments as part of this process? The role of social workers in this and how it contributes to the disparity?
Absolutely. So like alternatives to policing is definitely what we're looking for. We're looking for community-based alternatives to policing. We're looking for how can we integrate social workers, into these folks. I mean, I got a call the other day from a community member who was like, do you know of any like direct service providers that I can go to like right now? And I'm like, I don't do direct service, but I can look up someone for you like right now. And I'm like, what's going on? And she's telling me the issue, but she's like, I really don't want to call crisis because they're going to have police come and that's just going to make the situation. And I'm like, that was something that was like a really big theme throughout our visioning sessions with community members, especially now in the climate that we're in. We are afraid of police officers. And even if I myself had never had an interaction with a police officer, seeing people who look like me in the media have these, these experiences, that's like curious trauma that I'm traveling with, right? That's the same reason why you might feel that anxiety, or you might feel your heart racing, or you might like, how do I act in this situation? Even though I've never had a negative interaction with a police officer, but it's just because of that rhetoric, right? And so like, it's definitely something that we're looking for and looking forward to, definitely working on. I mean, I think that the party line is, like defunding the police. However, we're definitely looking into how can we encourage, because there's a lot of pushback on it, because it's like, but social workers aren't public safety officials, and I'm like, okay, but we look at, police officers are supposed to be preventing crimes, right? But they don't show up half of the time until after something happens. So maybe we need to rework this our model and what we think of as public safety, right? If someone is coming into the situation, or maybe even have, social worker ride-alongs or something like that, or if you're responding to anything, a house call or something, DV, anything, a social worker should be present and should be taking the lead on that. It's not that you're taking power away from that police officer, but you're the expert in that situation and knowing how to diffuse that situation. And then once things are out of your purview, and okay, this is not what we thought it was, when we got the call, and then you can hand power back over. But, we don't know what that really looks like right now, but the community is 100% behind integrating social work into the public safety model.
It's such an interesting conversation for us as a profession, right? Because I think fundamentally, we know that the systems are broken. We know that there is a place for us, but there's also the narrative around defunding the police. And we as a profession haven't really come to an understanding about what does our role look like? What should our role be? Defunding completely, there's definitely a time and a place for an officer to arrive if my house is being broken into. But it's reimagining the police and the social workers' role within those systems. Yeah. So it's a fascinating conversation to have and to really think about with the community of what the players should be and who should be arriving at homes, who should be taking the lead, and how can we create proactive systems and structures that support our community so that ultimately officers don't have to be called, right? I think that's the ultimate goal.
That's the goal.
That's the goal. There's so many great resources that you provide in here. And I think a couple of people online and a couple of people in the chat box anxious to take action, right? This idea of, the community conversations and having the coffee groups. Are there other volunteer opportunities for people outside of creating these things in their own communities? Are there ways that they can volunteer in the pilot programs that you guys will be working on?
Yeah, so I mean, the pilot programs, we just got signed into law. So at this time, the JJC is taking the time to do regulations, understand what the RFP process looks like, because people need to apply for this money. So I mean, hey, if you're someone who's interested in restorative justice and social work, definitely take advantage of the RFP process. According to legislation, we have to have community informational. So I'll definitely be sure to provide that information to Jeff so that you guys can get that, the informational to understand exactly what that looks like. It's probably going to be a while before we're actually able to, get these structures up in these communities. But I mean, in the meantime, I think using your own personal power to volunteer services. I mean, if there's something in community that's happening, like I said, we don't see mental health professionals at tables, right? Tabling, at the ball pits and the community cookouts, we don't see that. But we definitely need to normalize those conversations. So even if it looks like going to the local Boys and Girls Club and saying, hey, can we have a parent meeting where I can just talk about, mental health services and what some of those signs might be if their young person maybe needs some additional support. If it looks like, hosting your own community event right now, that might be great. Hosting your own community cafe. So a community cafe can be something that's held independent of the Restorative Justice Hub. So yes, everything that's written in the Mental Health Toolkit is written to support the Restorative Justice Hub model, but that's not to say that it cannot be done independently. Everything is structured in a way that's something that can be done independently. You don't have to do an entire Restorative Justice Hub or do an entire, telehealth line. You can just do a community cafe, and that might look like renting out, Starbucks for an hour or something, or going to the local library and putting up some flyers, or doing social media campaigns and saying, hey, if you're interested in mental health, or going to schools and saying, hey, I'm interested in hosting something at your parent night. So we can, talk about, mental health services and answer any questions that your parents might have about community resources. So like right now, it's definitely personal power. Definitely personal power while we wait for the legislation to be like kind of hammered out and we get these, we get the RFP process up and running, our regulatory things, on the government side. And I'll definitely be able to share that process with you 100% along the way. But right now, I think just, reading the toolkit and just seeing if anything sticks out to you about, and distributing the toolkit can be very helpful as well to anyone who may be looking, who works with this population of kids. And yeah, but yeah. I see something
also,
here.
oh, go ahead.
Yeah, where to look for the RFP process. So that's going to be the RFP process. We ran through the JJC, that's the Juvenile Justice Commission. It's a New Jersey office, so I'm pretty sure if you just go to NJ.gov, look for Juvenile Justice Commission, the RFP process will be there as well. Once that's up and running, I'm definitely going to keep you guys in the loop to let you know when that's up, and read the first toolkit, because the first toolkit gives you everything that you need to do. The RFP, the proposal, everything is outlined there. We give you samples for everything, the budget, the grant proposal, everything is in there. So you can take it and tweak it to your organization or yourself or whatever, however you want to apply for the funds. But we made it incredibly easy for you to be able to get this. And we want people who are in spaces, like this, who are mental health professionals, who care about young people, who are community centered, to take advantage of this. We don't want other government organizations to take over this, because right now our government has failed us historically when it comes to juvenile justice. So we definitely want these community-based organizations to take the lead on this. And we are located in Newark, New Jersey, Beth.
Yeah, I think it's such an important thing. I feel like all social change starts at the personal, initiation, right? And what a great time for us as social workers to engage with our school systems and our local community while we're waiting on the RFP, while we're waiting on the systems to get up and running. What a great time for us to reach out to our school districts, whether you've got children in them or not, to say, there are these toolkits available. Let's talk about what this looks like in our community. How are you implementing, restorative justice? How are you addressing the mental health needs of the kids in our school? Particularly now, when there is so much happening, right? The kids have been home for 18 months, sometimes longer. They are now going back into school for the first time in years. And it's going to be a tough year, I imagine, for all involved, right? But social workers can reach out to the schools and ask them about this. How are you going to be, using mental health services? How are you going to be connecting with the resources in the community? How are you going to empower the parents to look for those signs of mental health needs in your kids? Because they're going to emerge.
And also, how are we adjusting our approach to teaching and behavior in light of the pandemic? A lot of kids are at transitional periods, right? So I was talking to a parent and she was saying like her kid was going from 4th to 5th grade, and she was actually switching schools. So she started her 5th grade over online, and she recognized signs of depression in her daughter because, one, I no longer have my social system. That my friends, I'm not with them anymore. I'm also in this new space, new teachers, new kind of level of expectation that's expected of me to perform. And I am so disconnected from everything that's happening. And that's, a 9-year-old, we're talking like a 9, 10-year-old. And she couldn't find mental health services for her daughter. And the systems were just like overwhelmed with like how many young people needed services in light of the pandemic. And I think that we oftentimes, there are invisible population. We sometimes don't realize how heavily the things that impact us impact our kids, right? The pandemic was hard on everyone, and especially for these little minds who can't process all of this emotion, who are feeling these very big things. We definitely have to, when we're talking about engaging with our schools, how are we adjusting our approach to discipline, to teaching, and grace, in this time as well, because we don't want to exacerbate mental health issues for young people.
Yeah, and the school social workers, Beth, you mentioned something that you noticed that kids with in telehealth that kids who got in trouble for attitudes did a little better online, right? So it's easier to mute yourself, pause yourself, or have a parent intervene on and not get in trouble for the attitude. But I think the children this year are really going to struggle with this return to in-person, right? And even just, they're all arriving at their school and their spaces with different familial backgrounds and different beliefs about masks and vaccinations, and they're all being required to follow the same rules. And, you know, if the kids get one message at home and a different message at school, that causes anxiety and fighting and distrust and just a lot of issues that are really going to emerge for these little humans. So it's going to be a rough year for them, and to make sure that we're supporting them in the best way that we possibly can is going to be important. Absolutely. I wonder if social workers can also reach out to the school social workers, right? So offering their services, you know, I think sometimes school social workers are limited in their resources. You're often the only person in that room. But if we can support them by offering trainings and, you know, offering to table and talk about mental health services that we provide, or even just mental health services in general, really getting into those spaces to help support them in the work that they do. I wonder if anyone else has questions, comments. I want to give you an opportunity to raise your virtual hands. Scrolling through the screens. So while we wait for other people to chime in, I'm curious if you have thoughts on, we know that we can get involved on a personal level, start making changes in our community, volunteer, create stuff, create programs, definitely be looking for the RFP. But in terms of the advocacy work, how can the people on today's call help move the needle forward on this issue, on reparations, on holding our representatives accountable to doing what needs to be done, to saying the words, to engaging in these difficult conversations? We'd love to hear your thoughts on that.
Yeah, I mean, we have an action center on the website. I just pasted the link there. Our action center kind of just, it posts all of the positions that we have on all these various different things. And it makes advocacy very easy because one of the tools that we use at the Institute is called the Phone to Action campaign. And the Phone to Action, what they do is you just type in your zip code and it'll tell you who the legislators are. And it'll send a pre-written note just saying that you're in support of such and such legislation or such and such action. And then when I do it, my legislators respond back to me. So it's a nice way to not have to think too hard about what you're going to say, but to also get your kind of virtual vote out before it's attached to a vote. And then also, you also have to recognize that your legislator might be on a certain committee, in the legislature, or maybe even be the chairperson of that committee, and they can actually bring up some of these, or they can actually bring these things to the floor. And so that's incredibly helpful as well. So using the Action Center to understand a little bit about all the various different campaigns that we have, because we have so many. There's the Say the Word Reparations campaign, which is urging the governor to provide a reparations task force to talk about what reparations may look like, because I know when we hear reparations, we automatically think cash payout, but I feel like some of the structures and the things that we are experiencing are more important. And so we're not necessarily talking about cash payouts, but we're talking about reparations through investment. And that may look like free college. It may look like, land banking opportunities for, housing, different ways to undo redlining, all of those different things. So establishing a task force is the best way to get the players at the table to talk about exactly what those kind of reparations can look like. We have our Pennies on the Dollar campaign, which is something that's really trying to close the racial wealth gap. We recently had got the victory of ending gerrymandering in New Jersey. So like people who are incarcerated are counted in the communities that they come from and not the communities where the jails are. We also were able to get 83,000 people in New Jersey got their rights to vote restored over the last 2 years. And so we're fighting now for full restoration. So those who are currently incarcerated can vote. There's so many things that we're doing, right? And so like we're still, you know, the pandemic definitely shifted us, because before the pandemic, we were definitely at a place where we were calling for the Youth Justice Transformation Act, which would close youth prisons indefinitely, not build any new structures, and also provide a $100 million investment, which is very similar to the $100 million investment towards opioid treatment that New Jersey invests in. We asked for a $100 million investment to build up this community-based continuum of care. But unfortunately, when the pandemic hit and, you know, we kind of were in a financial crunch, we shifted, right? And so that's, we asked for bits and pieces, $8.4 million, you know, for restorative justice. And now we just released this mental health toolkit. And so we probably asked for a little bit more. And so like, we're always constantly thinking about the little ways that we can continue to, you know, to chip away at that budget. And so now that we're near post, I don't know if we're post-pandemic, but now that we're in a different space, we are going to begin again asking for the closure of youth prisons, right? Because our prior governor, Chris Christie, already announced closure of Jamesburg and Hayes, right? But it's right, what, 4 years, because it's re-election time, since we've had our new governor who has not yet given us any dates. So we're going to continue to pressure Governor Murphy to give us dates for youth prison closure for Jamesburg and Hayes. And then the reason why we want to close these prisons is because, like we said, it costs almost $500,000 to incarcerate them. Hayes Girls Prison is it's being funded as if it's at full capacity, which can hold 40 girls. Unfortunately, it's only 2 young women who are incarcerated there, and we're spending we're spending as if there are 40 young women in there. And that's a waste of funds, right? So we definitely want to encourage youth prison closure. So just visit our action center on NJ. That's NJISJ.org/action_center for those who are on Facebook and maybe can't see that. Just go on there. You can get a sense of everything that we're working on. We're going to a bunch of things simultaneously. So definitely do that. I think that's call to action from now. And Beth, thank you. I do know that SURJ has a reparations bill. Right now, we're not trying to push a bill. We're just trying to get a task force established so we can talk about like what reparations look like. Just because like politically, it's not likely that we'll get a cash payout, right? So we want to talk about like what that looks like. And so if we can come to a consensus on what reparations may look like for New Jersey, who desperately needs it to undo some of the racial harm that's happened over centuries. Yeah, we definitely want to continue to do that. So yes, visit the Action Center. Send your legislators those urgent emails to let them know that you support the work that we're trying to push forward, and hopefully in the next coming years we'll get those closure announcements, and we'll be able to see a New Jersey without youth prisons.
I think the other thing to mention, which does not go unnoticed, is that right now we are embarking on elections, right? And it is incredibly important to hold your representatives and those running for office and seeking your vote accountable for their votes, asking them specifically where they stand on reparations task force, demanding that they move forward on some of these critical items, and making sure that we are supporting people who uphold the work that you are doing, the values of our profession, and making sure that they know that social workers are keeping an eye on these issues, that we are constituents with a voice, and we're powerful in organizing, and that we are going to continue to move forward and hold them accountable. Our committee, our political action committee, will be making endorsements of candidates who share our vision for a healthier and stronger and more equitable New Jersey, and are committed to doing the work. So we look forward to supporting them and hopefully moving the needle there too. So for those on the call and watching on Facebook, you can look for those announcements in the coming days from us as well. So I just encourage you all to make sure that you know who your legislators are, to make sure you're holding them accountable, and make sure that they know that you're a voice and a constituent who's going to make sure that our issues are heard. We're rounding out an hour. It goes by so quickly. I feel like I could talk to you forever about these issues. A lot of people on Facebook sharing thank yous, saying that the presentation was so informative and that they're empowered to continue to do this work in their own spaces. And I'm really thankful as well for sharing your knowledge and doing the work. And it's so great to see a social worker leading the charge on these reports. So we're so grateful for the work that you're doing. For those of you watching, if you have follow-up questions, just send them over. We will connect you. We will also be following up via email with the resources presented today. So you don't need to save them from the chat box. I know some of you are having some trouble copying those links, so we'll make sure that we're sending them out via email. And again, the presentation was recorded, so if you found it helpful and informative as we all did, we'll encourage you to share it with your friends and your colleagues so that we can continue to build a community that is stronger here in New Jersey. Thank you so much for joining us, Ashanti, and sharing your knowledge and for all the work that you're doing here in New Jersey.
Thank you for having me. I really enjoyed it. Thank you.
Thank you all for joining us, and stay tuned for more community conversations.